Hey everyone, it's Alex Savage at KTVU Fox 2 News in the San Francisco Bay Area. Today I'm joined by Dr. James Swantuck, who is the Chief Medical Officer at PlushCare, which is a virtual healthcare platform that is nationwide, and PlushCare is now offering free coronavirus antibody tests to anyone who wants them. So, Dr. Swantuck, tell us first of all, how many people have already applied to get one of these antibody tests, and who should be looking to get these tests?
We have seen more than 2,000 people, and we're testing a couple hundred people per day now.
Wow.
People are very interested in getting these tests. The type of person that really wants to get tested definitely includes the curious, people who had an illness back in February or March, testing wasn't widely available, and they're really interested to know, did I have it?
So, what is the process to go about getting one of these tests? And maybe that will include sort of an explanation of how PlushCare works and interacts with the major health insurance providers.
So PlushCare works just like a regular doctor's office, except you don't go into the office. We are all online. You choose a doctor, you choose a time to see that doctor, and you have the appointment by video chat. The doctor can talk to you about, why get the test? What do the results mean? How does it work? And then they place an order, just like a prescription. And you go into a lab, and that part is in person. You go into a Quest labs and you get your blood drawn. And then about a day or two later, the results come back and you can see them in the app, right in your phone.
And it's right there. So the results come back pretty quickly. I mean, obviously we've heard about how the antibody tests, are really going to be critical to our notion of trying to regain a sense of normalcy here, because we want to have an understanding of how many people in our society potentially have been infected with the coronavirus already, to kind of build up that herd immunity. But will you talk a little bit about what is the importance of doing these antibody tests for as many people as you can?
That's exactly right. So the antibody test is not just for curiosity. It has other implications. As you're pointing out, the epidemiology, or understanding the spread of where this is in the community, how many people have it, that's important data for us to get. The second piece is understanding how long these antibodies last in your system. If we test people now, and then we test people again in months down the line, we know these antibodies stick around. And then the third piece, and maybe the most critical, is do these antibodies offer you protection against the virus, against getting it maybe a second time? That's a question we don't know the answer to yet. We're not certain. But if we look at other viruses, if we look at other similar viruses, oftentimes antibodies do provide some level of protection. Whether that's complete immunity or partial, we just don't know yet with this virus. But I think you can have some sense of relief when you have these antibodies. It can give you some confidence that you're probably somewhat protected.
Speaking of kind of reopening society, I mean, how is the testing data that you guys are gathering here, the results that you're going to get back from your patients? How is that information, you think, going to be used in terms of the larger public health picture? I mean, are you sending this data somewhere to be able to be used to gain an understanding of the spread of coronavirus?
Every test that we do report it to the public health agencies when it's positive, so that they can collect their data. It's a requirement. Mm-hmm. That's anonymous data, of course. But internally, we've also collected a wealth of data. And what is unique about it is that it's really geographically diverse. Most of the data that's out there is testing people in New York or in Santa Clara County, for instance. There's been big studies in the news about that. Mm-hmm. But there hasn't been one yet that's really been either nationwide or a large region of the country. So we're hoping to release that data soon.
Okay, I was just going to ask you if you have any preliminary information on, the antibody tests that have already come back on your end of things. Do you have a notion yet of how many people uh,
Yeah.
show signs of having the coronavirus antibodies?
So it's pretty early with the data we have, but we're seeing about a 6%, 6.3% positive rate, which is in line with other studies, but it suggests that the disease is out there. We're not testing random people. We are testing people who either had symptoms or they're very interested in getting tested because they think they might be exposed. So that may skew the data a little bit higher, but it's still, I think, important and adds value to our understanding of this epidemic.
Yeah, it's important to point that out, that the people most likely to seek out one of these tests are people that, as we talked about, had symptoms of some kind in the past, or think they might have been exposed in some way. But it still is interesting trying to do more widespread testing. I'm sure you've heard about this, the antibody test. There are so many of them that came to market so quickly here. And there have been some studies, that have talked about some of the false positives, the high rate of false positives for some of these antibody tests. How reliable are these antibody tests, do you think, at this juncture?
There's a lot of debate about this, as you're suggesting, a lot of controversy. At PlushCare, it was really important for us to choose a quality test. And so the test that we're using is one by Abbott Laboratories. It's the same one used by the University of Washington Virology Lab, which has been leading the nation in testing lately. And it is 99.4% accurate. So there are very, very few false positives with this test. A lot of the tests that are out there, and the FDA recently, yesterday, came out with more guidance on this. They're clamping down on some of the tests that aren't accurate and that aren't going through the right approval process. This test has already been through the FDA emergency use authorization process.
Yeah, because the FDA, they sort of loosened their restrictions early on to allow more of these tests to market. Do you think in some way that's a little bit dangerous to have so many of these antibody tests out there and being performed, and the data being reported, because those false positives, that's, there's a danger in somebody thinking that they had coronavirus and thinking that they might be immune and then going back out in the world.
That's right. You don't want people suddenly thinking that they're invincible, right? And that they can't contract this, especially if they don't actually have the antibodies. And so we don't even know yet whether you should be changing your behavior. And so I think you need to make sure that the test you're getting is from a reliable, trustworthy medical provider, and not buying them on Amazon or getting them off the internet.
And I suppose you would say to even someone, if you administered the antibody test and someone got positive results, is your advice to that patient still that they should not let their guard down when it comes to some of the practices, the safety precautions we're all taking as a society in terms of social distancing and wearing masks and all those things? It's not a sign that you should just sort of give up on all those practices, is it?
It's not a free pass. No, I think it gives people relief, and I think it should, because based on what we know, it's likely that you're somewhat protected, but you should still maintain all of the precautions that you've been taking to date until we have data really confirming that these antibodies protect you. And that's just a matter of time.
All right. So you've already done a couple thousand of the antibody tests, and is the demand continuing to grow for you guys at PlushCare?
We are seeing the demand for testing at PlushCare rising, and today we're doing a few hundred tests per day. And so with that accelerating, we hope we can help as many people as possible.
And again, it should be fully covered by someone's insurance, right? So the test should be entirely free.
The major insurers have put out statements promising that they will cover this test, and so we haven't seen any evidence otherwise. Yeah.
Okay. And so lastly here, you guys have this virtual healthcare platform with a couple 100,000 people already on board, and the number's growing, of course, because telemedicine is quickly becoming the reality here. How does someone sign up for PlushCare? How do they find you? How do they sign up? And what information should they bring with them?
You can find us at plushcare.com or on the app stores, the Apple and Android app stores, and just download the app. All you need to sign up is your insurance card and of course, your name and birth date.
Okay. Well, so if anyone is curious or believes that they might have been exposed to the coronavirus, free antibody tests being offered by PlushCare. There you go, a virtual healthcare platform. It is the wave of the future, telemedicine, and now it's it's happening here and now more and more. Dr. James Wantuck, Chief Medical Officer with PlushCare, really appreciate you coming on and talking about these tests. Thanks for your time.
Thanks for having me, Alex.
Okay, take care. And I will let everyone out there know that we have more information up at our website, which is coronavirusnow.com. And I'm Alex Savage from KTVU Fox 2 News in the San Francisco Bay Area.